Good morning, everybody. For those who don't know me, I am Dr. Heather Stanley Christian. I am the director of Unity Maternal Fetal Medicine, and I help women with complicated pregnancies figure out what is right for them within quality care, even though the outcomes may be varied. So, today I would like to talk about some ultrasound findings that are very common in doing ultrasounds, but they're often a source of great anxiety. And so I'd like to use today to give you some of the facts and dispel the anxiety about that. We're going to talk about the echogenic intracardiac focus. Now, that is a common ultrasound marker. What is a marker, you ask? A soft marker are seen on ultrasound. These are minor findings. They may be normal variants, but sometimes they're known for association with aneuploidies. So today we're going to talk about the echogenic intracardiac focus, or the EIF, but there are others such as the echogenic bowel, the choroid plexus cyst, the single umbilical artery, the urinary tract dilation, the thickennuchal fold, the absent or hypoplastic nasal bone, and then the bones of the femur or the humerus, or both, being short. I will address these different markers throughout our Knowledge Wednesdays. So stay tuned if you have questions about any of those markers. So the echogenic intracardiac focus was first described in 1987. And you have to remember, back in 1987, technology was really not as it used to be. It was described as a small area that reflects brightly on ultrasound. When we define brightly, we mean as bright as bone. So I did a Facebook Live about ultrasounds in the past, but just to refresh, the ultrasound has waves that penetrate through tissues. And depending on the density of the tissues, the reflections may bounce back as bright, shades of gray, or black. So this echogenic intracardiac focus bounces back on the ultrasound image as being as bright as how the bone would reflect. This EIF is usually found in the ventricles of the heart. It may be seen in the left or the right or both. It is important to remember that up to 5% of fetuses that are otherwise normal can have this finding. Also, in some ethnicities, especially Asian mothers, it can be observed in up to 30% of normal fetuses. So, what is the echogenic focus made of? It is thought to be made of very tiny areas of calcifications, microcalcifications that are present within the papillary muscle of the heart. The papillary muscle is a strut that keeps the valves from flopping all about the place. And so in that strut, you may have these tiny calcifications. They're so tiny that they're not visible to the naked eye. So if you are at an ultrasound and it was determined that your baby had an EIF, first of all, I'd like for you to breathe, because it's not a structural abnormality. It is not associated with any heart malformations in the fetus. It is also not a problem of heart function. But why is it there, you ask, and what should be done about it? And that's a reasonable question. The first thing to do is to assess the mom for her risk of aneuploidy. In other words, what is her risk of having a baby with the top three chromosomal conditions? Trisomy 21 is the one that is most associated with uh, echogenic intracardiac focus. So we assess for age. We know that women over the age of 35, their risk of having a baby with Down syndrome increases after the age of 45. And that risk jumps up significantly at the age of 40. So we assess the mom. We ask how old is she? Did you do any screening tests? Did you do a cell-free DNA test? Did you do a quad screen? Did you do a integrated test or a combined first trimester screen? Is there a family history of echogenic intracardiac focus? Is there a family history of Down syndrome? Now, an important point with a family history of Down syndrome is that only 5% of families will track with a history of Down syndrome. The majority of babies with conditions of Down syndrome are sporadic. A family history would be shown as recurrent multiple pregnancy losses in the early pregnancy. The other thing that should be done is to ensure that a detailed ultrasound is performed to confirm or ascertain if there are any other abnormalities. So let's kind of take a few scenarios. Let's take mom. So you have had a screen, whether it's a cell-free DNA, a first trimester, an integrated, or a quad screen. And that screen was normal. And when you had your ultrasound, they found an isolated EIF. And you're worried. I would say don't worry. It's considered to be a normal variant. There's another scenario where you did the usual aneuploidy screening, again, an NIPS, first trimester, quad screen, and there's an increased risk of trisomy 21. And also an isolated EIF is found. I would suggest that genetic counseling is sought to ascertain what the likelihood ratio is of this ultrasound finding in the setting of an abnormal screen. Information is really what's given for genetic counseling. Risk assessment is what's given, and education is also what's given. There is a third scenario where mom did not get screening for whatever reason. She's assessed to be low risk in the pregnancy, so you're less than 35 years of age, and there's an isolated EIF. You would be considered as being likely, the baby would be likely having a normal variant. However, genetic counseling should be obtained so that we can appropriately modify the risk by calculating what your age risk is and calculating the likelihood ratio with just having an EIF. So in summary, a negative screen and no abnormalities and no other markers equal normal variant. There is no need for a specific follow-up. There is no need for a fetal echo. There is no need to tell the pediatrician. There is no need to worry about it. So I hope I was able to answer some of the questions. We're going to continue on this theme of ultrasound markers, and our next marker that we will talk about, excuse me, would be the choroid plexus cyst. This is Dr. Heather Stanek Christian. Thank you for spending the time with me this morning. I would like for you to breathe throughout the day. Try not to absorb everything as a worry. Things are uncertain, but if we just take one thing at a time, we can get through the day. And I hope that this one thing that may be on your plate of questions was answered through this video today. You can reach us. We have a brick and mortar office in Claremont. So Winter Garden, surrounding areas in Florida, we are at 17323 Pagonia Road, Unit 227 in Claremont. Our telephone number is 352-404-5544. We are on Facebook at Unity Maternal Fetal Medicine. We have a website, unitymfm.com. And if you have any questions, if you'd like to perhaps schedule a telehealth, please give our office a call and we'll help you in any way that we can. Want you to have a wonderful Humpback Wednesday, and thank you for being with us today.